I'm Dr. Kelly OMD, like I said, and it is a movement to educate, encourage, and inspire 1 million people and their families. So that means multiple millions of people to live their healthiest and wealthiest life. And that's spiritually, physically, financially, mentally, and emotionally. And the way that we do that is we focus on what we call the Viva Life 5 through meditation, journaling, exercise, optimizing our nutrition and our sleep while we drink our water, as well as making sure that we offer and bring to you webinars, podcasts, as well as what we call an affirmation room. And the webinars are Mondays at 7:30 p.m. Eastern Time. The podcast actually happens 6 days a week, and the affirmation room happens once a month. That being said, let me introduce Dr. Brahe. She is an amazing dermatologist, finishing up her residency in San Diego. She is a leader of leaders, but she is a doctor of doctors as well. We are so happy to have her here. Dr. Brahe, tell us a little bit about yourself and the top 3 things you want us to know in your webinar tonight.
Well, good evening, everybody. My name is Brahe, and thank you so much, Dr. Kelly, for having me on a chat with everyone. We're going to be talking about alopecia tonight, which is the medical term for hair loss. This is something near and dear to my heart and something I really love treating in my patients. And my top 3 takeaways would be that hair loss is more than just a cosmetic concern, and it absolutely deserves workup and treatment. Number 2 would be that your health affects your hair. So everything from your nutrition, your vitamin deficiencies, to major life stressors, that all plays a role in how your hair presents, and can be a really good a clue as to what you're feeling underneath. And 3 is that hair loss is treatable. So don't feel like you need to suffer in silence, and absolutely reach out and talk to a dermatologist today if you need to.
And we're so excited because, many of us, we have our hairstylists, we have our beauticians, we have our estheticians, and you know what? They're great at their craft, but there's nothing like having a dermatologist in the Zoom room. And this is a rare occasion. So you guys be ready, listen, and make sure you get your questions ready. Dr. Brahe, take it away.
All right. Good evening, everyone. And again, thank you, Dr. Kelly, for having me on to talk about something that I'm very passionate about. Like I mentioned before, alopecia is the medical term for hair loss, and it's just one of the many conditions that I treat as a dermatologist. Hair is such an important component to who we are, like how we see ourselves, how we present to the world. And so there's massive cultural and social significance, as well as tradition that gets tied in with hair, and no pun intended there. Appropriate diagnosis and treatment then of hair loss isn't just a cosmetic concern, but it's really a holistic physical and mental health concern. So how do I approach hair loss? The first thing to do is to define what counts as actual abnormal hair loss. So your hairs are constantly in either a growth phase, a resting phase, or a shedding phase. And so in that sense, it's normal to shed some hair. The number that we as dermatologists throw around is about 200 hairs per day, which sounds like a lot, but it really shouldn't be particularly noticeable because you're probably losing some of that on your pillow, some of that on your car on the way to work, some getting stuck on your purse. So it shouldn't be so much that it's noticeable. Most people are not sitting around and collecting and counting all of the hairs that they shed. And if they are, I feel like that may be a different issue. But a common way that I ask people about whether or not they're noticing more hair loss is like, are you noticing more, hair in your shower drain? Are you noticing more hair coming out in your brushes? Or like, as you're kind of styling your hair, do you notice that things are just kind of falling out? Things like that. Also checking with people about their hairline. So when you look at your part, can you see more of your scalp? Do you feel like your hairline's receding? Those are all really good questions to ask when you're trying to determine if someone's really experiencing hair loss. Now, everyone's baseline is different, and so you need to be cognizant about different hair texture types and styles as well as your own bias that's based on your own hair. It's very easy to look at someone's scalp and think, well, that's a lot more hair than I have, so I think it's fine. But I really caution against that. Photography can be really helpful in evaluating for change over time too. And in the age of digital photography on our cell phones, you can always ask someone to kind of pull up some pictures and like, show me what your hair used to look like and show me what it looks like now. Once you've established that someone is indeed suffering from hair loss, the next step is figuring out the underlying cause. And so there's many specific and different types of hair loss, and we have very specific names for them in dermatology, but I'm going to keep it simple tonight for the purpose of time and try and break them out by topic. If you were to open up, our dermatology textbook, we have all of these really big ones. It'll break hair loss disorders into scarring and non-scarring forms of alopecia, basically meaning permanent forms of alopecia versus non-permanent forms. But in a practical sense, I think thinking about them more by their causes can be a really good good spot to start. And especially, you know, we're not looking at these things always under the microscope, which is really where that scarring and non-scarring comes from. So the first topic I would say would be hair loss caused by genetics. And so the second would be mechanical factors. And then the third is going to be kind of like hair loss that's caused by some sort of underlying medical disease. So if you're experiencing thinning of the scalp, and I would say as a man, we typically think about like the crown of your head, kind of like right where a baseball cap would sit, or a receding hairline, kind of like your temples coming up. Or as a woman, typically we think about this as like a receding hairline and then like widening of your part. So if you notice, you know, your part is kind of thickening and you're seeing more of your scalp. And then you think to yourself, you know, this is what my mother, brother, father, sisters, you know, this is what my family kind of looks like and what they started looking like about my age, then you may be fighting genetics there. And so we call this pattern alopecia or androgenic alopecia in dermatology. And it's really a combination of genetics and hormones that are driving that hair loss. It doesn't mean that we can't treat it, but it does mean that since you're fighting genetics, you're fighting hormone changes over time, that you're probably going to be treating it for the foreseeable future. The faster that you catch it, the better you can kind of maintain what you have. So it's always easier to kind of stop things in their track versus waiting for experiencing a whole bunch of loss and trying to get stuff back. So just because, you know, your parents have balded and you're concerned that like you're going to go down that way doesn't mean that you can't do something about it. Similarly, if you have noticed that you're dealing with like a very stubborn patch of alopecia on either one or both of your temples, and then you've gone back to the family photo albums and realized that like it's been there for forever, you may actually be dealing with something called triangular temporoalopecia, which is basically a congenital issue. It means that you are born with it. Unfortunately, the only way to really deal with that would be camouflage, you know, with hairstyles, wigs, haircuts, things like that. Or sometimes we actually go and do like an excision of that area of skin where you don't have it. I have a little bit of this kind of on one side of my scalp, like where it's a little bit thinner. And so that's why I rock bangs now, because it just kind of covers it a little bit. Switching gears, we'll go to hair loss that's caused by mechanical factors. What this is really getting at is a diagnosis called traction alopecia, which is probably something that kind of you've heard a lot about, especially in the African American and skin of color community. I think that traction alopecia gets a bad rap sometimes because it becomes this like de facto, oh, like you have braids. Oh, you know, you've used a lot of like hot styling tools. Like you probably have traction alopecia. And the thing that I feel most strongly about is that while traction alopecia can definitely be something that, you know, is like its name suggests, due to traction with either braids or pulling your hair into a bun, things like that, it's not the only thing that we see causing alopecia in skin of color. And so I caution you, if you ever go to somebody and, you know, like across the room, they're like, oh, like that's traction alopecia, you're all good. I would either find a different dermatologist or maybe dig a little bit deeper, because while it may be the underlying thing, there's a lot of other things that can cause your alopecia as well. But when we talk about traction, it is exactly what it sounds like. So you're talking about hair loss basically at these kind of like at your hairline, and sometimes in the back as well, that's mostly from that mechanical pulling force. And we see this a lot in the military, you know, for hair regulations with, you know, people that have to pull their hair back in buns all the time. You see this sometimes in patients who have, you know, really, really long hair, but maybe they work in the medical field, so their hair is tied back all the time. And it puts a lot of pressure kind of on those follicles. They're holding on for dear life, but there's just so much traction in there that eventually, you know, they're going to get a little tired out. We see this a lot of times in the skin of color community, a lot of times due to like braids, locks, hairstyles like that are putting a little bit more traction on the scalp. And the other thing that you notice is that in those populations, there's actually a genetic mutation called the PADI1 mutation that tends to be in skin of color that also makes your hairs a little bit more susceptible. So not only do we have traction-based hairstyles, but you also have a genetic basis for being more at risk for this. And so the biggest thing with traction is catching it early to make sure that it's non-scarring, because if it goes on for years and years and years, it can be scarring, but giving your hair kind of breaks. And so, you know, I used to keep my hair pulled back all the time. And then I started noticing that I was getting some thinning kind of at my, you know, frontal hairline as well, because my hair was all the way down to my back and, you know, it was always in buns and braids. And so I actually took a break and cut my hair short specifically so that I can just kind of wear my hair without less traction. not because I'm ever not going to have my hair long again, but just because it kind of gives you breaks. And so sometimes finding ways to style your hair, taking a break, doing something that's a little bit more, natural, non-traction for a while and switching back. I never like to tell people like how they can or cannot wear their hair, because I understand that like that's a huge part of you and like what you want. And I would not want somebody telling me how to style my hair. But also recognizing that like trying to take breaks and give your scalp a little bit of a rest can be really, really helpful in the long run. And then finally, we'll talk about hair loss due to medical conditions. So this gets into things like alopecia areata, which some people I think have probably heard about because of Jada Pinkett Smith. Like she's made this a little bit more in the news. And alopecia areata is essentially this condition where your immune system decides to attack its own hair follicles. So what you get are these round, like very special coin-shaped kind of spots of baldness. And then they're these just perfect little cue ball shapes, and people will notice them because, you'll notice in the back. I feel like alopecia areata is one of the major things that I notice in grocery store lines. Whenever I'm like in line at the grocery store, I'll look in front of me and like, I tend to feel like, oh, like you have a little bit of alopecia areata. The good news about it is that if you leave it alone, in 80% of cases, the hair will come back and it doesn't need any treatment. But in some cases, it becomes so severe that those little spots start as little holes and then they start to become most of your scalp. And we have a lot of really great medications and injectables that can treat those terms as well. And then they also have things like telogen effluvium. So telogen effluvium is a whole scalp shedding that typically happens about anywhere between 3 and 6 months after a major kind of like life stressor. And that stressor can be an emotional stressor. It can be, a physical stressor. So we've seen this with folks like about, 3-6 months after they've had COVID, now they're getting all this shedding. Or a lot of times you see it in ladies who were pregnant and then they delivered. And then, 6 months later, they're like, why am I losing all my hair? And it's just it's all over. It's not like one specific spot. Like when we talk about pattern alopecia or traction, where it's just at the front, it's just like, my hair is just shedding and I'm not sure what's happening. The good news with telogen effluvium is that it does resolve with time. But again, if you don't treat it, you're going to lose 80% of your hair and then be kind of like fighting that uphill battle to try and get it back. So that's a big thing as well. And then just common things being common. So anything that's causing inflammation on your scalp can irritate those hair follicles. So even untreated dandruff, just kind of left up there for a long time. I think it's something that we see in dermatology a lot. And people are like, oh, like I just have a little bit of flaking. But, you want to treat that inflammation, because even just a little flaking over time can eventually annoy your hair follicles enough to get hair loss. And then underlying conditions such as, iron deficiency, anemia, low vitamin D. I feel like pretty much everybody that I check for vitamin D tends to be low vitamin D. I just bought myself some little vitamin D gummies recently, and they're so easy to take in the morning. So, doing little things like that to kind of help with your underlying health can be a big factor in just kind of helping your hair be a little bit more luscious. Same thing like thyroid dysfunction. We see that a lot in families that have hair loss. So doing an appropriate lab workup, sometimes we end up having to take biopsies for, different scalp conditions. But in general, I think when you go to get worked up, like make sure that people are doing their steps to check your labs, check what's underlying, do a good history and not just kind of wave it off.
So I love what you're saying there. You said a lot, and I'm just going to make sure that we take a little bit of there. So you talked about kind of the why and the 3 top things that are causing that. And then also talked about the lab workup. So, and then were you going to talk about a little bit about the treatment for telogen? You mentioned you're losing hair after major stressors. As we know, in certain populations, the stress is much higher than other, and internalized stress is much higher in certain populations. So how do they get out of that spiral of the hair loss associated with the stress?
Yes. So it's a fantastic question, and exactly what people usually ask, because especially like if you had a baby or, say you just started a new job and you're like, well, thanks, I never thought about not being stressed before. I guess I'll just take that on board and be less stressed. A lot of it has to do with maintaining the hair that you have so that it doesn't fall out. So what I usually recommend folks is if I'm noticing like, hey, like this seems like you have telogen effluvium, you know what I mean? Like the timeline fits, your history fits. And as I'm doing like a little hair pull test, which is basically you just kind of like pull a little bit and see if it falls out. If that's working, then you're like, okay, well then our goal right now is to maintain as much as you have so that you lose less over time. So honestly, that's a huge role for either topical or oral minoxidil, which is the drug name for basically commercially available Rogaine. Like everybody sometimes people tease about like, oh, like Rogaine, is that really a thing that works? But like minoxidil is a great drug. And so, it's available over the counter. And you can apply it topically. In some cases, we'll actually give it orally as well. It can come with some side effects, so it kind of depends on your patient population. But that's a way that it's going to kind of help you to not lose as many. It's going to help you to hold on to what you have so that you lose a lot less. And then a lot of times looking out for, is there also a vitamin D deficiency? Is there something else that we can optimize? And usually I'll refer folks to, therapists, psychiatrists for mental health. I tend to ask my patients about it because I think that, psychological stressors can play a huge role in our lives, and mental health is physical health. So, if you're going at a two-pronged approach, it's like, all right, let's get you on the minoxidil to make sure that you're not losing as much hair. Also, like, let's try and address your stress. Is it something that we can help you work on? Do you want to talk to somebody about that? And then in some cases, if it's like, oh, well, I just had a baby, then, telogen is somewhat expected because it's just like the huge physiologic task of growing a child, delivering a child, now feeding a child and everything else. But even, helping people find support groups and things like that are going to help them to take a break can go a long way.
Thank you. Thank you. Thank you so much for that answer. We have a question from TD. I have 2 areas of both temples that were damaged from braids in 2007. It will fuzz over with hair, but it won't grow long. Is it too late to see a dermatologist?
I would say it is not too late. So the fact that you still have some hair in those regions, like what you're describing is kind of like the peach fuzz, means that you still have hair follicles there. It does sound like what you're describing sounds a little bit more like traction alopecia, where you've had something pull kind of in the temples. And so you've had some loss of like major follicles, but the fact that you still have those baby hairs means that there are hair follicles there and they're holding on. If you told me that it had gotten to the point where like, it's just skin, like you don't actually see any openings with scalp hair there, then a lot of times that means that it's scarred. But if you have little baby hairs there, then I think that's totally an appropriate time to go and see a dermatologist. If you ended up seeing me, I would probably check your labs to see if I couldn't fix a vitamin D deficiency, see if there's an underlying anemia, see if there's any thyroid dysfunction, things that we can optimize. And then honestly, minoxidil is a great thing to use too. You can do that, kind of like put it on a toothbrush and kind of brush it on those edges and help a little bit there too. That would help.
Ooh, great question and great answer. We have another one from TR. My hair grows to a certain length and will shed, regardless of routine trimmings and washing. Should I see a dermatologist?
So when you say a certain length, like how long are we talking about in that length?
About shoulder length, yes. About
shoulder
length.
length?
Then,
okay.
Yeah.
So sometimes what you may be dealing with is you may be dealing with a little bit of breakage. So if you're noticing that your hair seems to be kind of like not able to progress past a certain part, sometimes it could be from like either hair damage or breakage. So we have there's something called bubble hair, which is basically like if you're using a lot of like warmer kind of tools to style your hair, whether that's a blow dryer. I think about this every time I blow dry my bangs. A blow dryer, curling irons, like any sort of hot tools, it can essentially damage the hair over time. And then they basically get to a spot where they're like, this is where I'm going to break. Similarly, if you notice it in hairstyles, like if you're always tying your hair back kind of at that shoulder length, like if you're doing any sort of ponytails there and the hair is already weakened from hair dyes, styling tools, things like that, then it could be contributing. But in general, like the best thing to do is like, if you're concerned about it, I think it's worth seeing a dermatologist, because if it's something that's if it's more like it's kind of breaking at the end versus like a growth issue, I would go and get worked up, I don't think that that's going to hurt at all.
Good. Great question, TR. And then from RT, what are the unique challenges in treating alopecia in people with skin color, and how can these challenges be addressed effectively?
So I think challenges for treatment of skin of color alopecia. I think a big challenge that kind of faces dermatologists across the board is, in general, you have somewhat of a lack of understanding, I think, of like hair practices. We have certain ways that we treat things like very commonly. Like you think like, oh, like I have, somebody has dandruff. What's the answer for treating dandruff? And you're like, oh, well, I'm going to give them antifungal shampoo. But, like a lot of folks don't even make that connection that like, not everybody washes their hair every day, So like giving somebody a shampoo and just being like, just use this when you're in the shower every day, or like, sometimes things are lost in translation. If you give somebody a bottle of Ketoconazole shampoo and you're like, do this when you take your shower, like wash your hair with it. And there's been no discussion on like, how often do you wash your hair? Like, how are you using this? How are you gonna, how long are you gonna put it on? And then somebody comes back and it's not better. And you're like, well, haven't you been using the Ketoconazole shampoo? And they're like, well, yes, but I also wash my hair, once a week, or like I go, once every 2 weeks, I have braids in, whatever. I think that lack of understanding sometimes can be detrimental and can be a challenge. So I think open and clear communication is just important in general. I would like to be able to say that your doctors should all know ahead of time to just ask, but at the same time, sometimes patients are booked every 10 minutes, and you're kind of rolling through and you're trying to get through the day and you want to be able to help as many people. And so sometimes those questions don't get asked. So I would say be your own advocate as well. Like, feel free when people are prescribing you things, if you hear something that you're like, yeah, I'm not going to use a shampoo. Like, I have braids in and I'm not getting my hair washed that often. And like, that's just not going to work for me. Then, stop your dermatologist and be like, is there something else, like a different vehicle? Because most of our medications in dermatology come in different vehicles, meaning like they can come like an ointment. They can come as a solution. They can come as a foam. They can come as an oil. And so, sometimes people just aren't thinking because they get very kind of, I think, muscle memory and like the things that they tend to prescribe. And like I find that in my skin color patients, they tend to say like, hey, like, an oil works really well because I already use a lot of hair oils. So like giving me a corticosteroid that's in an oil is a lot easier to use than like giving me a shampoo, and usually I'll just ask my patients like, what, like, these are your options, I need you on one of these, but like, what do you think is going to be easiest to use? The other thing too is I think pairing with estheticians can be very helpful as well. There's a huge, I think, vast amount of knowledge in our hairstylists, not only because we spill the tea every time we're getting our hair done, but just in general, like they're looking at your scalp, they can see what's going on. And I have a lot of patients that come to me who say like, oh, like I was getting my hair done and my, my esthetician, my hairstylist noticed that I had, this pigmented spot. So like, hairstylists find melanomas, hairstylists find rashes, and hairstylists are really great about noticing with you over time, like, hey, your hair's been getting a little bit thinner. Like, I've been doing your hair for a while and you're definitely like getting a little bit more on your part. You should see someone. So I think being able to work together with those communities instead of any sort of hierarchy of like, well, I know better and you know less, like, that's not really what it is. We're all dealing with the same things. We need to be able to work together. I think that can be a challenge sometimes too.
Oh, I love that. I love that collaboration. The collaboration is so important. Let's see. I've had a bit of quadruple whammy: postpartum breastfeeding, work hair requirements, ruptured ectopic, thyroid issues, and feel that my hormones are out of order. Looking to stop the shedding 2 years postpartum, 1 year post-op, and fix my hormones. Is it a dermatologist or OBGYN issue or both? Anything I need to ask in particular to get referred to the right clinic?
Oh, that is a great question. So what I would say is that because you're dealing with postpartum and some hormonal things as well, I would definitely want you to see an OBGYN to get kind of like the hormonal side worked up. But I also think that it would be worth seeing a dermatologist because we can help you out with in terms of like making sure. It sounds like what you're describing like definitely sounds like a hair shedding from like a telogen effluvium. If you've got, the postpartum, you've got the hormonal changes, you've also got some thyroid stuff going on. Usually your PCM can manage the thyroid. And so I would make sure that like if you're not already on treatment for that, you get checked out for your thyroid. And that's something that your dermatologist can order the labs to check for that, but we usually aren't the ones that kind of manage thyroid replacement type medications. But we can certainly help with like the minoxidil. We can certainly help with looking to see if there's any other cause of inflammation on your scalp and confirming that it is the right diagnosis. I think in general, like, even if I'm able to tell you like, oh, I'm probably going to tell you this, it's worth going to see someone in person because a lot of times I think we think that we have an idea of what we have. And I can tell from history that like, yeah, that sounds like that fits. But until somebody can actually lay eyes on your scalp and make sure that it's not something else going on, you just want to make sure that you're treating what you actually have. And so don't ever feel like you're like taking up space or wasting someone's time. Like, we go to school for this, like make us do our job, like come in and get checked out so that we can treat the right thing. But for you, I would say you want to see an OBGYN for all the hormonal stuff. You want to make sure that you're talking to your PCM about the thyroid and getting that replaced if you need to. And then I would absolutely see a dermatologist as well. And when you see your PCM, you can bring up exactly all the issues that you brought up to me and ask. You can ask for a referral. I think sometimes people are afraid to ask specifically and like be our own advocates because there's so much stigma about like, oh, drug seeking or like, you know, people playing the healthcare system. But like, if you don't ask, sometimes people don't think about it, you know, and it's your body. And at the end of the day, like if you know what you need, like I think it's totally valid to ask.
Great question and wonderful answer. And I agree. That's why we bring on all of our specialists here and consultants, because as an OBGYN, a lot of times I'm your primary care and we work with the primary care. But if you are the primary care, we'll do the workup for the hormones.
Mm-hmm.
But like you said before, we can't just say, oh, you're pregnant or postpartum. It's a part of the process. We definitely need to look into it. And so when we have relationships like this, we can actually help each other figure out, okay, what could something be? And also endocrinologists can help as well with hormones, because not all the time is it the easy ones that we think about. So that's a whole nother conversation, but I think all of us working together makes a huge difference. Let's see, we have time for, I think, one or two more. I'm active duty in the military and was diagnosed with androgenic alopecia via a scalp biopsy in 2023. And I would like to know, she's biracial and she wants to get pregnant in the next few years. And she was saying to her dermatologist that she didn't want to use Minoxidil. And is PRP or mesotherapy an option outside of Minoxidil, or are there other alternative therapies in people that are pregnant or trying to get pregnant?
100%. So thank you for your service. Appreciate that. And I apologize for your androgenic alopecia. If and when you get pregnant, that may or may not help because of the hormone changes there. So it can be something that hopefully will make things better as you go through that. But also, I completely understand the concern in terms of using different medications, especially when you're trying, you know, or are actively pregnant. Topical minoxidil is safe to use during that period. So unless they're giving you like an oral version, the oral version works really well, but because it was originally a blood pressure medication, it's probably not something that I would give to somebody when they're pregnant or trying to get pregnant. But the topical version is okay. PRP has gotten a ton of attention recently in the hair loss community, and some people are swearing by it. Like I think when PRP kind of first came out, for those who don't know, PRP is like this platelet-rich plasma. They basically draw a vial of your own blood, they spin it down, you know, in a centrifuge, and then you take like all of these great nutrients off of the buffy coat and you inject it back. So it's not quite a vampire facial, but what you're doing is you're taking these like really good growth factors and nutrients from your own blood and putting it into areas of hair loss. I have some people that have had fantastic results with PRP. I was just at the American Academy of Dermatology conference, and it's been gaining a lot of traction. The only problem with it is that it's typically not going to be covered by insurance. So you're going to be dealing with an out-of-pocket cost. And then sometimes people can be very hesitant about doing elective procedures on someone who's pregnant. So you're not really injecting anything foreign. You're injecting basically a spun down version of your own blood. So in that sense, like it's not a drug that you're injecting. I would have to look specifically in terms of like approvals for if that is something that they do during pregnancy, but I wouldn't be surprised if people are like, like, I don't know about doing PRP when you're pregnant, just because it's procedural. But I have heard good things about it. So I don't think that that's a bad thing to try. If you want to do something natural that's not going to be a medication, there are a lot of studies out there that say that rosemary oil actually works as well, if not just like slightly less good than minoxidil. So if you don't mind the smell of rosemary and you're into, you know, essential oils, like rosemary on your scalp can be a good alternative too while you're going through that.
Good question. Wonderful answer. So we got I learned one thing about the minoxidil, so thank you so much. And I'm sure that people would say, you know what? Ask your OBGYN. Because they always do, right? But I feel kind of the same way with PRP. If it's your own blood and we go over the risk benefits and everything like that, then it's an option for you as well. So thank you so much. I think you're right at the 8 o'clock hour. I did have a question because everybody tells you to take collagen, inject collagen, all that in your hair and all these other wonderful things. What's your perspective on collagen, taking, injecting? What are your thoughts?
Unfortunately, I wish that all of the oral and injected collagens worked as well as they say that they would, because as we age, obviously we make less collagen, you make less elastic fibers. It's why we all start to get a little wrinkly. It's why, you know, we're not as plump as we, you know, used to be. But unfortunately, anything that you're gonna ingest it's a great source of protein because you're eating, you know, the protein from it, but it's not gonna it's gonna get digested in your stomach and it's not gonna end up in your skin or in your hair. And so a lot of times I personally think that like, if you're going to do, you know, I know like Costco sells that like big blue, like collagen, you know, I found it in our break room at one point. If you wanted it's just I need more protein source, I think that's fine. I think there's probably other better forms of protein that you could eat. But in general, like if anybody tries to sell you on like, oh, like I'm going to inject collagen into your scalp, it's going to make your hair luscious. Like it's probably a waste of your money. Now, if getting those injections makes you feel really good and not stressed and like helps with your wellness, then like maybe it's helping from a wellness perspective and like reducing your stress. But it's probably not doing what you're intending it to do. Unfortunately, you would probably be better off taking, you know, like prenatal vitamins. That's going to really up your iron and your vitamin D, and help with biotin, things like that. But injectable or like digestible collagen is really not doing what you think it's going to do.
Thank you for that answer. Thank you so much. I had to get that. Well, everybody, you know how we do. We start on time, we end on time. And that being said, Dr. Brahe, did you want us to leave us with anything or any information?
I'm happy to leave my email if anybody has any questions. I would just say, you know, stand up for yourself, be your own advocate, and like don't be afraid to ask questions, you know, like it's your body. These are real issues. And I think in so many cases, you know, we're taught as a society that like, oh, like that's cosmetic or like, that's not a big deal. You don't need that, you know, and like, is hair loss going to kill you? No, absolutely not, you know, but at the same time, like it affects how you feel about yourself. And that means that it's worth being treated. So don't feel bad about taking up space and asking for help.
Love it. Thank you so much. And thank you everybody for coming. But before you leave, remember to follow us on all your social at Dr. Kelly OMD at Viva Life Health Hub, and go ahead and sign up for our consistent webinars. And if you want to have the full Viva Life experience, make sure you choose a package that works best for you. That being said, have a wonderful day and don't forget to do it. Viva Life. All right. Thank you for being a part of the Viva Life experience. I'm Dr. Kelly OMD, board certified OBGYN and healthcare executive. If you like what you heard, then please go ahead and like, share, and subscribe. The reason why is because we are trying to educate, encourage, and inspire 1 million people to live their healthiest and wealthiest life. And this is what we're bringing you. We're bringing you educational videos. We're bringing you podcasts. We are bringing you webinars with subject matter experts, including myself, about the topics that affect you the most. So go ahead, like, subscribe, and share. We are everywhere. Have a wonderful day. Viva Life.